I am Katira Kapoor, and I have the privilege of being the Senior Director of Health Promotion, Wellness, and the Spark Your Health Talk series at the 92nd Street Y. It is my pleasure to welcome you to this special event, part of 92NY's Spark Your Health Talk series and AARP's Virtual Community Center. Spark Your Health and AARP are proud to present Debra Whitman, AARP's Chief Public Policy Officer and author of The Second 50, Answers to the 7 Big Questions of Midlife and Beyond, in conversation with Tara Parker Pope, the Well+Being editor for The Washington Post. They join us tonight for a meaningful discussion centered on the dynamic and sometimes complex journey through the second half of life. Together, they will share invaluable insights drawn from Deb's research and conversations with leading experts. Our format this evening will be a moderated discussion followed by 15 minutes of Q&A. Please feel free to submit your questions into the chat throughout the duration of the program. I am now delighted to introduce our moderator for this evening, Tara Parker Pope. Tara Parker Pope is an award-winning journalist and the Well+Being editor for The Washington Post. Before joining the Post, she wrote for the Wall Street Journal and the New York Times, where she was the founding editor of the popular consumer health site Well, and a part of the newsroom team that was awarded the Pulitzer Prize for their coverage of the pandemic. Tara is also an Emmy Award winner for Life Interrupted and author of 3 books. Welcome, Tara, and thank you for being here with us this evening.
Welcome, and thank you for joining the 92nd Street Y and AARP tonight, where we're having a conversation with aging expert Debra Whitman about her groundbreaking new book, The Second 50. All proceeds from the sale of The Second 50 benefit AARP Foundation. Deb is AARP's Chief Public Policy Officer. She previously served as staff director for the U.S. Senate Special Committee on Aging and holds a doctorate in economics from Syracuse University. In her new book, she raises the most important questions we face as we age and offers practical advice for a longer, healthier, and more meaningful second half of life. Deb, thanks for being here.
I'm really excited. Thanks for having me.
You know, I've been reading your book, and you really start with a just riveting personal tale that just gave me chills as I read it. Do you want to share a little bit about that with our viewers today?
So I've always pictured having a long life. I don't know why exactly, maybe because it's what I work on aging. But when my husband and I were getting married, we're both of different faiths. So we wrote our own wedding vows. And instead of saying, I'll love you forever, we said, I'll love you till I'm 103. And so it's been a joke between the two of us for years that he's a year older and what's going to happen when he's 104 and I'm only 103. But when he was 48, he was hiking. We had been on a family trip, and my daughter and I flew back early. And he suddenly felt something was wrong. And he's a teacher, and so he goes through CPR training every year and realized that this is something he should pay attention to. So he flagged down some hikers. And sorry, I get a little emotional about this, but he flagged down some hikers who called 911, and Boulder Mountain Rescue ran up the mountains where he was, carried him down, got him to the emergency room where his heart stopped. And it's a condition called the widowmaker, because most of the time, if you're not happen to be in the emergency room when your heart stops, your life is over. And so in that moment, luckily they got a couple stents, and he's been fine ever since. But in that moment, that 103 almost didn't even become 50. And the good news about the story is not only that he lived, but he really took it as a moment to reflect on his life and think about his sense of purpose. He's a teacher and loves what he does. He thought about his community and all the people that had helped him throughout his life. So he wrote over 50 letters to former teachers and coaches and family and friends, thanking them. And he came out of this would have been tragic situation with just a renewed focus on living. And so I think what that story tells me is that we will still plan for 103. Right. my second 50 plus. But really try to live in the moment and to take advantage of what we have in our lives.
Well, it's quite a story. And how did that moment influence this book? How did we get from that to today where you're now talking about the second 50 and you've written a book about it?
So I've been working on aging issues for 25 years. And yet when I was turning 50, I realized I had a shelf full of books on what to expect when you're expecting. My kids were about to go to college, so I had, how do you find a college and a career and all kinds of things in between. But I couldn't find anything that really talked about what I would expect as I age. And so I wrote down a list of questions that were meaningful to me, and those became the chapters of the book. So I thought about things like how long will I live, especially given the story I just told you, and will I be healthy doing it? I thought about practical things like will I have enough money and how long will I work? Some things that people don't want to think about, will I lose my memory and how will I die? And so I wrote these questions down and then did tons of research, talked to a whole bunch of experts, some of who schooled me, and interviewed people all over the country. And that's what became of the book, including stories of my own family who were my guinea pigs, because most of us, when we look at aging, we sort of look at what's happening to our parents or our aunts and uncles or our grandparents.
Right. Well, you did do a tremendous amount of research. It was very impressive. So through all of that, what did you learn that most surprised you about aging and just getting older? What was your biggest surprise?
I think it was some preconceptions that I had that when I talked to the experts, I found out I was completely wrong about. So I was going to write in the How Will I Die chapter that everybody needs advanced directives. And so I talked to Dr. Diane Meyer, who's a palliative care expert, and she said, we've actually found out that most of them are not followed, and that oftentimes you don't know what you will want when you're perfectly healthy signing those documents. And you may check a box that says, don't put me on a ventilator. And then when COVID hits, and you might get sick and go to the hospital and be put on a ventilator, if somebody looks at that advanced director, you could be taken off. And so it's much better to reach out and talk to somebody you trust and have them be there in a time where you might not be able to make decisions for yourself. That having a person that you care about and that cares about you is far more important than a piece of paper.
But you're saying that people might fill out these forms and then have a change of heart later. So what's your advice? Is this something that we should be constantly talking about with our family members, or just when we have medical appointments? Like, how do you have those conversations?
I think one important thing is again, to realize you may be more comfortable in your older age and with less capacities than you think you would be today as a perfectly healthy person. We sort of prejudge, well, I would never live in a nursing home, my father has said. And then he was having some health issues, and he was like, it's close to home, people could visit me. Maybe that would be something I would consider. And so, it's not just talking once, but really having the conversation as you go about the things that matter to you.
I think that's really good advice, because we might have different goals or hopes and dreams when we've got small children at home versus, when our kids are in college versus, maybe when our parents are aging. And, where you are in your life phase, I would think could influence what you need and what you want for yourself, right?
Absolutely. There's no one path in our second 50. And, I think that was a real struggle in writing the book, is understanding that we start at 50 from a different place and we all have our own paths. And most of us will have chronic conditions as we age. But another thing I found interesting is that we're actually happier in our 70s and 80s than we are in our 40s and 50s, much happier. And in fact, if we ask people, are you healthy? even though people have all kinds of health conditions, they say, actually, I'm pretty healthy. And in fact, more of them say they're healthy than the 15 through 20-year-olds. And so again, it's a sense of perspective that changes, and a sense of accepting what our situations are as we age.
So what I like about this book is that even though we are maybe talking about some hard things and aging, and there's always the questions that you have to ask about, healthcare proxies and all those things, it's also hopeful and optimistic and joyful. The second 50 can be pretty great, right? And, you talk about mindset being important. So tell me a little bit more about what do you mean when you talk about what is mindset?
This is one thing I hope everybody that reads the book comes away with, is that, yes, healthy habits like eating right and exercising help us to live longer and be healthier, but just as important is your mental perspective. And so if you think that aging is going to be a time of decline and you're going to be miserable, you live over 7 years shorter than if you think of growing old as a time of opportunity, of wisdom, of contribution, and of value. 7.5 years. And Tara, it's not just you live longer, but you have fewer strokes and heart attacks. You recover from illness in a shorter time period. Even they tested people's brain volume, and it's more if you have a positive view on aging. And I think that's because there's this positive cycle that you think aging is good and you take better care of yourself. I work out every Friday with a 70-year-old who kicks my butt, and she is having the best time of her life. She calls it her so-called retirement because she's so busy doing so many things. And so I think there's ways that we look at our lives and look in hope, and that isn't just a nice thing to do. It's actually as important as eating right, exercising, and doing all the other things that we're told to do.
So how does one cultivate that? Because I think we learn a certain attitude in life. We might be inheriting some certain traits, but how does one cultivate a mindset that sets themselves up for better aging? How do we do that?
Well, first, let me tell people how you can see what your mindset is.
Okay, good.
An easy way to do is write down the first 5 words that come to your mind when you think about aging. And if they're positive, you have a positive view. If they're negative, you have a negative view. And that just sort of says what your point is today. These things can be changed. And ways to do it is to catch yourself. So if you say, oh, it's my birthday, I can't believe, I'm growing another year old. You notice comments that people make to you or around you that have a negative sort of ageist connotation. All of those things, that recognizing is really an important step. The next is really, trying to have intergenerational friendships where you can actually meet and get to know people that may surprise you, because you may think, okay, well, this 90-year-old can't do anything, and I'm so blessed in my role that I get to work, regularly with the vibrant 90-year-olds as our volunteers. So, changing how you perceive is something that you can do consciously. And again, I think it pays off on the happiness side, and certainly on the health side.
Can we talk a little bit more about those 5 words and that test we can give ourselves? So what is a word or two that might signal that somebody doesn't have the best mindset for aging? Like what kind of, not to put you on the spot, but, would it be, I'm trying to think of what I would say. I might say aches, pains, worries about, finances, or I could see myself really focusing on that aging is maybe memory lapses or things like that. So what kind of words, should we think about? What is a sign that I've got the right outlook about aging? Do you have any thoughts on that?
Yeah, I think probably because they're my kids, and probably because I've chastised them every time they've said something that wasn't appropriate and could be construed as ageist, I sent them the 5-word quest, and my daughter came back with things like wisdom, knowledge, care, love, because she had a very close, loving relationship with her grandparents. So again, there's no one word that's going to make or break your health.
Right.
It's more of that's more of just a kind of a gut check of, okay, well, how am I feeling today about my future? And if you're looking forward to your future, if you think that you as a person are valued in your future, all of this really matters. And this research comes from Dr. Becca Levy in Yale, and she's just did a fabulous job looking. This is true across cultures, across countries. This relationship between your views on aging and your own health are really, really robust.
You had another exercise of thinking about people who are older that might inspire you. You mentioned Jane Goodall, who is truly amazing. What does that do for us when we think about Betty White or Jane Goodall or these people who are aging so well, it seems to us?
I think it again is trying to break the stereotype in your head of seeing all old people as being dependent or having issues, and saying, oh, well, wait a minute, here's Jane Goodall still saving the planet at her age, or Betty White still making us all laugh. But it doesn't have to be a star or celebrity. A lot of us have very important people in our lives. I grew up with my grandmother, and I think that really set me on the path for my own career. And she had schizophrenia. My mother was her caregiver for over 50 years. But boy, she loved me. And, I just had this really close relationship with her from a very young age. And she was kind, and I could get as many hugs as I wanted from her. And so that memory of just thinking of somebody that can be important to your life and that is valuable as they age, I think can really make a difference.
Do you think that relationship you had, not everybody has that opportunity to have that close relationship with a grandparent. Do you think it influenced your interest in issues of aging?
Absolutely, 100%. Especially because, and I work in policy and trying to make things better, I understood that had she not have things like Social Security disability and SSI that helped cover her healthcare needs, my family probably couldn't have sent me to college. And so I understood both the value of somebody that needed care and had great connection, and also how important these systems are that I work on a regular basis to helping families.
So one of the questions I hear a lot from readers, people are really afraid of aging because of the brain health issue.
Yeah.
And it is noticeable as you get older that, you maybe have to focus more on where you parked your car, or you forget a word here and there. And when it starts to happen more, you start to worry a little bit about it. I mean, do you find that fear is out there? And, what do we know about brain health? I think some people are worried that aging just means it's all downhill and it's just you're destined for dementia. I think you're trying to change the perception, right?
I'm trying to change it in a few ways. One, don't worry if you forget a word. You probably forgot a name a decade ago earlier too, but you just didn't stress you out. There's all kinds of different types of forgetting, and little things that you've done your whole life aren't part of cognitive decline and dementia. If you forget how to get from your supermarket to home, if you forget what a key is in the car, those are serious issues and that you should get them checked out. But actually the rates of dementia and Alzheimer's are going down, even though the number of people who have it are going up, because the baby boom generation has higher levels of education, which is protective, and overall better health. the rates of people getting cognitive decline and dementia are going down. In fact, only about 15% of people in their 70s have even mild cognitive impairment. So it's not inevitable. And then more importantly, there's things you can do to lower your risk. And these are things like getting enough sleep, back to eating right, exercising. What's good for your heart is good for your brain. Being socially connected to others. Being lonely and isolated is really bad for our brains. And then doing things that test your brain, cognitively stimulating activities, we call them. And that can be everything from doing a crossword puzzle, learning a new skill, trying something that you've never tried before. All of those things can help reduce our risk factors for cognitive decline and dementia. And then if you do notice something, do go and get it checked out, because it may actually be not cognitive decline and dementia at all. Recently, my father was prescribed some new medication, and he started hallucinating. He started seeing trees come out of the wall. And so the first thing I said is, Dad, are you on any new medications? Because this was out of character for him. And eventually we got him off and everything stopped. So it could be a vitamin deficiency. It could be medication. So try and figure out what the underlying cause is before you get too worried, or don't do anything about it.
So I've seen some research that suggests that about 40% of dementia and cognitive decline cases can be, slowed or reversed with lifestyle changes. But I find that sometimes making these simple lifestyle changes, they seem not big enough. People don't always believe it. Do you find that? How can my diet affect my brain health, or whether or not I get a good night's sleep? You want to talk a little bit about the role of sleep, for instance, in healthy aging and in brain health? Why I think a lot of people are a little skeptical, that I think they feel like it's the genetic lottery. It's not really what I do. How do you convince people that these are real changes that have meaning in their lives?
Yeah, and the 40% includes things that we can do personally, and also reducing air pollution and some things we need to do societally. But it does matter how well you take care of your brain and your heart and the rest of your body and how we age. And every little bit makes a difference. You asked specifically about sleep, and there's sort of a Goldilocks. Sleeping too much isn't healthy. Sleeping too little isn't healthy. So getting good rest, and again, that varies a little bit by person. Eating, doing exercise can make a big difference in your overall physical health, but also on your cognitive health. So I don't have the numbers for dementia, but if you practice 5 healthy habits: diet, exercise, maintain a healthy body weight, don't drink, and don't smoke. If you do all 5, you live more than a decade longer. But even if you do 1, you live 2 years longer. So
just 1 can add 2 years to your life.
Just 1 can add 2 years to your life. So my dad stopped smoking when my brother was born, so he's checked that box, right? And so, I feel like there's so much, there's so many other books out there that make people feel bad about what they're not doing, or hold these unreasonable standards. And this is really based in the research of, every little bit helps. And again, I would rather see you have a positive view. That's 7 years of life.
Right.
Right? I'd rather have you show me that you have a sense of purpose. That adds years to life. I'd rather have you eat a bad meal and sit around a table with lots of friends, because social isolation is the same as smoking 15 cigarettes a day. And so I have a kind of a more balanced approach to thinking about healthy aging, in that it's not that you have to pump iron and eat salad every day. It's a variety of things that you can do to make your life healthier as you age.
I think the idea that just simply sharing a meal with someone, this issue of social connection in aging, feels really important. I mean, I guess you could combine a few. You could take a walk with a friend, right?
Yep.
Or, dine out with a friend. So how do you, as you age, people are losing social connections, and do you have advice for being brave? And, you know, if you are someone who maybe you live far from family, or, you know, I think it's hard sometimes for people to get out, or if you know someone who's older, who maybe is alone, do you just have some advice about how to improve social connections as we age? Would you go to like game night or do a meetup, or?
I think all of those things. And again, it depends on the person and their mobility, as well as what's available in their community. But I do think trying to find others, and it can even just be in the grocery store talking to the checkout person, right? Having just that moment of connection can actually make a big difference. You can volunteer. Giving back to your community while you're with others can be a huge way to connect and feel like you have a sense of purpose and health. Going to church, and being part of a faith community. There's lots of different ways that you can find something that's meaningful to you, and to find connections with others. I would love to see more connections with younger people, because I feel like we have kind of a mental health and isolation crisis, both for our younger population and often for our older population. And so seeking out those opportunities as well to mentor or tutor or help people in either your personal family or your chosen family or others in your community can make a big difference.
You know, talking about the things we can do and interacting with young people and older people, you know, the intergenerational. I went to grad school in my 50s, and the thing that I got out of grad school that surprised me most, it was the relationships I made with people in their, you know, late 20s or the young people. And it was so, and they weirdly liked me too. And I was just like, wow, this is so cool. So, you know, when you talk about combining things, taking on new challenges as we age is one way we can help our brain, right? Going to take a class, maybe you meet some young people. Is that the kind of thing you're talking about?
It is, and it also helps you in your career and the ability to work longer if you stay engaged in education. Because that's another thing that I talk a little bit about in the book is, you know, when we've always looked at life when we had fewer years as sort of being in three stages, that you go to school for 20, you work for 40, and then you retire for however many you have left. And you know, as our careers are getting longer, we're going to need to think about education, and technology is changing so fast. We're going to need to think about going back to school in our 50s and making sure that we have the skills that people need. We're going to have to push our employers, who are less likely to offer older workers the chance for job training and skills development. So, and all of that does help to keep us sharper for longer.
It's interesting, I work with a variety of freelancers, and I have a freelancer in her 70s, and she runs circles around the kids. She's amazing. And whenever I have like a problem story, I'm like, call her up, she can handle this. And there's a wisdom and a competence and a confidence, I think, that comes with aging. Would you agree with that?
I would, and I'm glad you told that story, because we now have 5 generations in the workforce. For the first time in human history, 5 generations are all working together. And what we found is actually mixed age teams are more productive than ones that aren't as age diverse. And I think this is true with racial diversity and gender diversity, that having different perspectives and your friend who can solve every problem is probably a great mentor to your new reporter who's just starting to write and hasn't figured out exactly how to lay out a story. So, as people are going to need to work longer financially in order to fund our longer lives, both having continuous education and getting employers to see the value of having an age-diverse workforce is another really key thing, I think, for a good second 50.
It's good to remember, too, as a manager, as you're sort of putting together teams, that there's value to this mix, and not just keeping, the kids together, you know, the grown-ups over here.
Well, and we've surveyed people of all ages want to work with people of all ages.
Right.
Like, again, age segregation isn't something employees want. And so I think employers need to look at that and say, okay, you know, how can I build a better team?
Well, that's really helpful. But, you know, one of the challenges, I think, when you talk about aging is that there is a level of fear, and especially when we talk about brain health. And one of my questions for you is, how proactive should I be? I mean, a lot of people are like, do I really want to know if I'm on a downward slide? Wouldn't it be better to just enjoy life not knowing? How much should I try to learn about my brain health, and how proactive should I be?
This is another area where I think I changed my mind about, because I think I had some of that mindset of, well, there's not much you can do.
Right.
And actually there is quite a bit you can do. As I was talking about, like, even these healthy habits can slow down progression. But more importantly, they allow you the chance to plan and for you to build sort of cushions around yourself. One of the interviews that I did was with this woman named Terry Montgomery. And Terry was a firecracker. She had this beautiful purple hair as I was interviewing her on Zoom. And she had started Black Dementia Minds. And she said, you know, when she was diagnosed with early onset Alzheimer's in her 50s, she thought it was a death sentence. Like, okay, tomorrow life ends. And she said she slowly realized that there was actually a lot of life left in her. She said, it's not the same. You know, it's like, she talked about this metaphor of, like, I live in a big house and slowly I can't drive, and so the garage is closed off to me. And then slowly I can't work, so I don't use the office anymore. And then I can't really cook, so the kitchen is off. But she still has a lot of rooms to live in and grow and contribute, and those weren't closed immediately. So, you know, one of the things she wanted me to share was there's a lot of life still, even after the moment of a diagnosis, that your life isn't over. And there's a lot you can do to protect yourself and to, you know, spend time with your family while you still have capacity.
One of the things I've learned recently, science is changing so fast, and there's, you know, AI tools that can help diagnose people earlier or spot signs. And I think people are, you know, this question of why would I want to know, but it sounds like the science is changing to the point where maybe we do, even though we can't fix a lot of things right now, that an earlier intervention, you know, the science here is just moving really fast.
Yeah.
So learning early, you might be able to be part of a clinical trial or, you know, take advantage of some of, you know, the new breakthroughs. So you advise in your book the idea of taking a baseline cognitive test at some point. Tell me a little bit more about that. I
do, and at AARP we have a online program called Stay Sharp, and you can do a test, and I did it, and I'll admit I always forget people's names, and so some of the things that tested, like remembering lists of words, I didn't do as well on. I'm not surprised, but what I can do is go back in a few years and try it again. And that can be really helpful. Part of everybody's annual wellness visit for Medicare should be a cognitive assessment with your doctor. And if they're not asking you, look at a clock, that's a common one they do, you should ask them to do one for you, because it is important to see changes, like I said, because they could be low vitamin D, they could be a drug you're on, or they could be a sign of something that you need to worry about. Another piece of research that we've found is that in the years before you're diagnosed, actually a lot of bad financial decisions can happen. And people lose half their net worth in the 6 years before they're diagnosed, and their credit scores go way down. And so this is tragedy, because people worked really hard to save money. And so having buffers around you, if you realize that you may have some cognitive issues, you can get other people to help you with your finances. somebody who's safe.
Yeah.
I want to make sure we say that because you are also more vulnerable to fraud and exploitation too.
Right. So you talk about if you do get a diagnosis that suggests you've got some cognitive decline, you say make a plan, identify your network, who can help you to stay safe, stay active in your community, and socially engaged. So should we wait till then? I mean, I think this is interesting what you say about making a plan and identifying your network. Should we all start that sooner, when things are going great?
I think we should, and in some communities they do. I grew up in a tiny little town, and my parents had been driving neighbors, over 80 miles to the big city to go to doctor's appointments for years. And so, I think thinking through, okay, who can help me? What is important to me? Many people want to stay in their homes, or at least their communities. So looking at your house and saying, is this a house that I can live in if I had some mobility impairment, if I wasn't able to walk upstairs? Can I get to my bedroom? Could I get in the shower? And what are the things I need to do now when I'm healthy to put in a plan that can be helpful later? And so I think there's a lot of things and throughout our second half of life that we should be thinking of before we need to.
Right, so it's the next 50. So would you start, when you turn 50, would you start thinking about what does this chapter look like for me? How can I do it in a healthy, fulfilling, satisfying way? Like, should you have that thought process when you're 50? I mean,
well, I did. That's why, that's why I wrote down these questions and said I wanted to learn. And I realized some things like my house is not accessible.
Yeah.
I have 6 steps up or 6 steps down from the front door. And I never thought about them until we had a 90-year-old over to our house, and they looked at those like it was, the Grand Canyon. And I suddenly realized, wow, okay, this will be a problem for me too one day. And so I realize I will have to move at some point and find a house that is someplace that could be a forever home. Financially too, understanding what are the big expenses that people have later in life, specifically around the need for long-term care and understanding how huge those costs are. Those are the types of things that I do think, understanding whether Medicare pays for long-term care, it doesn't. That's one of the reasons why I wrote this, is because I couldn't find just all of that information in one place about all of these different pieces.
It is kind of overwhelming to think about it. And we talked a little bit before about end-of-life planning. And it sounds like a pretty dreary topic and something that we would rather not think about. What are your thoughts about how we can approach this kind of planning? Is it depressing? Is it something that can leave you feeling empowered and ready to take on the world? Like, what is the effect when you actually dive into this kind of daunting task?
We did a survey. That was another thing as part of writing the book. So I wanted to ask people the questions that I was looking at myself. And actually the fear of death and talking about death really declines as people age. People see it happening around them. They've lost their loved ones. They're somewhat open to having conversations in a way in their 60s, 70s, and 80s that I don't think I appreciated in my 30s, 40s, and 50s. And then I also, the most beautiful way to deal with death I saw on a study trip to New Zealand. And I met this woman, Katie, who started the Kiwi Coffin Club in a town in New Zealand. Because they were asking, they were asking at their local sort of community college, what type of class would you want? And she raised her hand and she said, I would like to learn how to decorate my own coffin.
Wow, okay.
And the people asking the question, sort of their jaw dropped like yours did. And yet afterwards, about 10 people swarmed her and said, I'd be really interested in decorating my coffin too. And so she started this club, and it's part arts and crafts. part social club, and part charity. So they build and decorate coffins for themselves or for loved ones, or even for children with terminal illnesses. And they get together and then they have coffee and tea, and it's the least morbid thing you've ever seen, because these are beautiful. Like, one was dedicated to Elvis and another one had hiking scenes for this woman. But I think there is a way we perceive that nobody wants to talk about death, and yet when I start talking about some of these things, I find people are really excited to say what is important to them.
Yeah, I was working on a story actually about end-of-life planning, and I thought, okay, I really need to just go through this process myself. And actually, I'm a big fan of the AARP website, and I'm not just saying that because we're here. I actually think it's a tremendous resource. I'm just amazed at all the answers. Like, whenever I have how does this work, or where can I solve this problem, I can find it there. And so I was using the website and using some of the tools to do my end-of-life planning. And I've got into this kind of zone, and I started thinking about, I am essentially parenting my daughter from the future, because I'm helping her through what is going to be one of the most, I'm going to get kind of choked up talking about this, because I thought about her at that time and the decisions she would have to make and how hard it would be. And I thought, this is like a great gift I can give my daughter, and I can still be the mom I want to be. I get very emotional about this. But it was a really beautiful experience, writing the letters to her and telling her what my wishes were, telling her that I've had a beautiful life and not to be sad. Look at me, I'm getting sad talking about it. But can you talk a little bit about that? I mean, I think we're so afraid of these moments, and I think there's so much joy and beauty in some of it. Would you agree with that?
I would, and thank you for sharing that. And
I know it.
I would love to read love to read your letters. I had never talked to my own parents about their wishes.
I know. Can you believe I'm such a baby?
And writing this book, I was asking them questions about all the chapters, and I got to, okay, Mom, how would you like your funeral? And she's like, oh, well, I just let you and your brother decide. And I said, no, actually, we would really want to know, so that we would want to do what was important to you. And she sort of, like, you could see her relax, and she said, you know what would be really important? I want 2 funerals. I want one here in my little town, and then one over where I'm going to be buried with my father's family, so that the family over there could go to it. And I would like this, and I would like that. And it was a great conversation, and it made me feel good, because hopefully that doesn't happen anytime soon. But when it does, I know what she wants, and I can give her that. Yeah. So I think it's, again, whether it's painting your own coffin or writing your wishes, or just having an open conversation with people, I think if we treat aging and dying as part of life, and understand there's sweetness and sorrow in all parts of our life, I think that's a really important step forward.
I think it's great advice. So let's talk a little bit about work, because work is one of those sort of defining parts of our identity in our lives. And then, we do get to a certain age where there's an expectation of, are you going to stay working? Are you going to retire? What are we thinking about work and retirement? Are we approaching it the right way? What advice do you have for people as they're trying to decide, as they get toward the end of the working career? Should they keep going? Should they do something new? What would you say to that?
I would say a few things. First of all, just as a fact, we are working longer. We have twice as many people working now than we did in the 1970s, working or looking for work. The second thing is, you hope it's your choice of when to stop working. Half of people in their 50s will lose their job involuntarily. And
That's
so,
scary.
and in their 50s, right? Yeah. And so once you've lost your job, it's harder to find a new one. So that's why I was pushing for keeping your skills updated earlier. But also being sort of curious about different types of work, I think, is really important. So part-time work, flexible work, gig work. Did you know that half of all Uber and Lyft drivers are over age 60?
I did not know that.
So there's all kinds of other ways that we can work that may just and we might need to help supplement our Social Security and our retirement savings. So being open to different ways of working, I think, is really important, as is making sure that we get employers to see the value of experience. And so I think as much as we need to strengthen our workforce, we also need to strengthen the demand for workers.
Do you think, I think some people are debating, should I retire? Should I keep working? Should I, maybe they have the choice, they've planned, but I find the idea of not working sort of boring. I can't imagine not doing something. Do you think that people should consider, if they can, if they have the work, I think culturally we just have this expectation. We need to just retire and not work anymore. But work can be fun for people, right? It can be stimulating.
It can, and I think that perception's shifting.
Yeah.
I think there are a lot of people who love their job. It's part of their identity. It keeps them intellectually engaged and learning. They have a family at their office, and community that they like. And so there's a whole bunch of people for work is a positive. There's also a whole bunch of people where work is really hard. They're in a physically demanding job. They have health issues. They can't wait to stop, but they have to keep working because they need the paycheck. And I think as we age, understanding that it's expensive to grow old, and there's a lot of extra expenses that come along when I spoke to one woman who had saved a lot and then needed massive dental work. And almost all of her retirement savings was lost, and she had to go back to work standing on her feet every day as a greeter in a grocery store. And so work can be a positive thing for many people, and it can also be a huge struggle.
But you also talk about creative ways to look at retirement, like gradual, like step downs, like maybe easing out of it. Is that something that is a thing now?
Easing out of it, yes. Going from full-time to part-time, doing consulting. As I said, these sort of gig work, and there's different kinds of job boards, or taking up platform work. So if you love grocery shopping, there you can make money on your own schedule. Those types of things are offering more and more flexibility for older workers. And remote work has been a huge boon for older workers who are. There's been a huge growth in the labor force of older workers since COVID, because more and more people can work remotely, and who may have health issues and find it harder to get into the office every day.
Yeah. So if you have mobility problems, a remote job might allow you to work longer.
Yeah.
Yeah, that's an interesting shift. A lot of people have questions about Social Security. They worry about it. Can we assume that we will have Social Security as we age?
Yes, we can.
Really? You can say that?
I say it with all... I worked for a decade on Capitol Hill, and I've probably analyzed every Social Security program a proposal that is out there. There are ways to make Social Security solvent for this and future generations. Now, let me give some caveats. One, every year we wait, it gets harder. We haven't touched this program since 1983, when I was 13 and in middle school, and right now it's scheduled in 2024 to not have money to pay out full benefits. I want to look at everybody and say it is not going bankrupt. There is still money coming into the system, but it's not enough to pay full benefits. So Congress and the President need to take action. I cannot imagine a world where they would wait until those cuts actually hit people who are retired. I just don't believe that it's too important. I do believe that it's too important to too many people for them to ignore it. Now, that said, we have a lot of different ways to do it, so I don't know how they're going to do it. And that's a problem, because I can't plan for my own retirement and how much I'm going to get for the program, because I have to wait and see what's going to happen. But I believe Social Security will be there for the future, because it's too important for people with disabilities, for survivors, for retirees. It's a major part of our programs that help us throughout our lives, and we pay into it every year. So we do expect to get something out.
So I think some of our listeners are very interested in issues of housing. You talked about your personal story, but can you give us some advice about how we should be thinking about housing? At what point should we start looking at, it's not that easy to move. And you were just saying you're going to have to think about your long-term home. What's some of the advice you would give people when they're thinking about housing and aging? Is it location? Are you close to family? Is it just details of what's in your house, rugs and sharp objects and stairs? Or what are the thoughts we should be having as we're thinking about where we live?
All of those things.
Okay.
At a minimum, take up your floor rugs so you don't trip, because that will get you out of your house faster than anything if you fall and break your hip. So make sure you live in a safe place, I guess is idea number one. Number two, location does matter, because you do want to be close to people you care about and who can care for you, as well as close to things like services. My parents love where they live, but it's an hour and a half to get to a major doctor. And that's going to be a problem for them as they're slowly unable to drive. So understanding location and services really matter. And then the type of the home and how it's accessible. Unfortunately, we're still building single-family homes for kids with lots of stairs, and we're not building enough of homes for single people who need single floor living. So we need to start doing that more. And one of the things we're doing is pushing also for things called like accessory dwelling units. Well, these are granny flats and nanny flats that people can put in their backyard, and either can be used to house a caregiver that could care for you in your main home, or if you want to live close to your family, a place for grandma to live or grandpa. And looking at trying to change and push zoning laws across the country so people have more flexible options for housing.
So when you're thinking about location, what should I ask because, my daughter who's 25 has been making life decisions based on where her friends are and her community. And I thought, well, that's so smart. I just sort of fell off the job and I moved all over. And I really like her priorities of saying, my friend group and being with people that I know and care about matters. And I think as we age, we should be thinking about that too. Would you say it's family or, kind of creating an intentional community with people who are aging, or should it be near hospitals? What are some of the things when you're thinking location?
I love the LGBTQ term chosen family, because I think many of us have groups of people who are just as close to us as our family, and people that would care for us and that we would care for. So I think that's really important. I do think understanding that your physical capacity and cognitive capacity may influence where you would live, and being open to saying, okay, this giant home with up and down stairs isn't sustainable if my husband have health issues. Just even having that kind of mindset of openness to, okay, well, what would be some options that we could be comfortable with? I've seen actually great moves by both my grandmother, who lived on a family farm and couldn't drive, and then moved in to an apartment with a whole bunch of other ladies that each had their own apartment, and it was kind of Golden Girls situation, and she could walk to church every day. Or my father-in-law, who met the love of his life down the hall after his wife died. And so, sometimes we view these other types of housing options as kind of the enemy. Oh, I would never live in assisted living, or I would never live in these places. But sometimes you can find a sense of community that maybe you are missing being in your own big house.
We need to tell those stories more. I think we have this idea that staying in your home, the house where you raised your family, that is the ideal of aging. And it might be important to people, but I think that assisted living and living, we had a writer, she's actually in her 90s and she writes for us and I love her so much. And she wrote about the decision to move into assisted living facility and how, leaving the home and just the gardening, everything was just too much. Mm-hmm. But all the worlds that opened up to her and the friendships she made, I think we don't talk enough about the opportunity of aging and the new relationships that can form. Would you agree?
Absolutely. I think, again, that's a major theme is, yes, it's not all sunshine,
right,
but there are a lot of good parts about aging and that we need to embrace. And part of that mindset is realizing it, right? Again, there's too much negative written about people as they age and not a much embracing that this is just a natural part of life. It's like saying motherhood is just the part you're in labor. Right? Yes, there are some hard parts to motherhood too, but there's also huge joys throughout that period of having children.
So how has this book changed your own priorities about what you want to focus on? Have you thought about that now that you've done all this research, you've written this book? Are you doing things differently in your own life?
I do try to adopt my husband's mindset on just gratitude for what I have. I do think that learning is always something I valued, and I had so much fun doing the research for this book. We didn't get into all the questions, but I spent 2 weeks trying to figure out why women live years longer than men. Actually, it was probably 3 weeks, and just got really into the data and research. So having a sense of gratitude, having a sense of continued learning, and more importantly, having kind of a positive plan of understanding that, like I said, okay, I might not live in this house, but maybe then I wouldn't have to deal with a garden or do some other things. Wouldn't have to vacuum so much. So understanding what is the bitter and what is the sweet parts of life.
So we only have a few more minutes. You've written this book. You've put your heart and soul into it. What do you want our listeners and the people who buy your book and read your book, what do you want them to take away from this?
I think two things. First, I hope I said something today, and for whoever buys the book, that actually makes them to think or helps them to learn or changes their perspective on something. So I hope they find something in there that's meaningful to them. And then there's the last chapter, Tara, and we didn't really talk about the last chapter. It's the one my mom still hasn't read. But aging is really hard in America, and we need to make it easier. We have programs like Social Security that haven't been touched in decades, or that have big holes in them, like Medicare, because it doesn't cover your eyes, your teeth, or your ears. 3 things that, of course,
are so important.
Are important as you age and have issues. And so the last chapter is, how can we make this easier for people? How can we make it so that everybody can save for retirement through their job? Because only half of Americans can do it through their jobs. And so I list a whole bunch of things that could make it easier for everyone. And so I also hope to nudge people who read this to say, yeah, I want it better for me and for my kids and grandparents, and push with their vote, push with their voice for movement into making aging easier.
Well, we're going to have to end on that note. Thank you for the work you're doing on our behalf and to help people, age, and for just, a wonderful contribution to help in a great conversation today. So thanks for being here.
And thanks for sharing your stories too.
Well, thank you for the tissue. So a recording of tonight's event will be available on the 92nd Street Y website and on AARP's Members Edition. And as a reminder, all proceeds from Deb's book, The Second 50, go to the AARP Foundation. You can find more information about the book at aarp.org/second50. Thank you and have a nice evening.